The South Health Campus involved patients and their families right from the very beginning. At every opportunity, we've taken the time to bring them into our meetings to help them interact with all of the healthcare providers as well as the designers of the campus.
One of our pillars is patient and family-centered care. So if they are full partners in care and providing meaningful engagement with us, then they are actually going to live it to lead it. They will help us bring to life what patient and family-centered care truly is.
They have a really great program. It's the Citizens Advisory Team, so there's a bunch of members from the community that have experience either as patients in the hospital or had family members in the hospital, and so they meet and have been engaged in the planning process of the facility.
I've been involved with CATS from the start 2.5 years ago. We've been involved both in design, picking out furniture, what color the building was.
We've talked about mental health and addictions. We've gone into the Baby Notes program in women's health. We've put work on bed testing, on food testing, on wayfinding. The list goes on and on.
Every time that there is kind of an important thing to discuss, it's always brought down to the committee level and just say, what do you think about this? And, take all that information and then move forward with it.
So we'd like to ask them things like how they would like to be addressed when we come into the room, if they would like us to wake them up if they're sleeping, for example. And we'd also just like to ask them for some input into testing some of our menu items.
In the planning phases of this project, we had mock-ups, and the community members and members of Citizens Advisory were involved. They acted as simulated patients, if you will.
We ran codes in rooms, we had people use them with stretchers, and had mock-ups of patient transfer, those sort of things. The community was involved with that, and they made a lot of good input on how we did the design.
And we were able to adjust both dimensions in rooms, locations of specific components of rooms, and it's changed some of our fundamental planning premises as well.
I think a good design is when you take into account everybody that's involved. And the community and the public are involved, and they should be here to have their input.
My favorite thing about the Citizen Advisory Team is just being able to come together with this committed group of people and help make a difference.
I feel when I walk in this building, it's something that I help part of a group that designed it, and I feel more part of it. I think the community has had a lot of input and a lot of influence on the new way of health.